If your power is fading after 60, don't reach for pills first. Try this instead. I'm Dr. Camila Vega. I've worked in urology for over 15 years, and I've sat with hundreds of men who walked in convinced that age had taken something permanent from them. They felt ashamed, embarrassed to talk about it, and ready to accept a quick fix. I want you to know something important before you pick up the phone for a prescription. Often the missing piece isn't a pill, it's a set of habits that can be changed. Today I'll show you 3 common mistakes that quietly erode sexual function after 60, and a practical, evidence-informed alternative you can start today. 10 minutes a day to rebuild connection with your body. 3 stories, 3 problems, and 1 step-by-step practice you can try for 30 days. If this is speaking to you, stay with me for the next few minutes, and subscribe for more straightforward, science-based men's health guidance. Comment below if you want to try the 30-day challenge. Tell me yes, and I'll read a few responses in a follow-up video. Here's the first mistake: automatic, fast, mechanically conditioned self-stimulation. Let me tell you about Hector, 67. Hector had a routine he'd repeated for decades. The same place, the same pacing, the same visual inputs. Over time, his brain and nerves learned a very specific pattern. When he tried to be intimate with his partner, it didn't match that pattern. He needed more intensity, more stimulus, and sometimes he couldn't reach orgasm except in that one learned way. He felt frustrated and ashamed. He blamed his body. He left my office convinced he needed medication to fix what he called his loss of sensation. What happened to Hector is something we see often and is rooted in how the nervous system learns. Your sexual response is not only hormonal and vascular, it's also a learned pattern. Repeated, rapid, high-intensity stimulation, especially when paired with strong visual cues, teaches your brain to expect a very narrow route to arousal. That process is called neural conditioning. Over the years, conditioning can blunt sensitivity to ordinary touch or partner intimacy, because the nervous system becomes tuned to a higher specific intensity. The result is a mismatch: more stimulus needed for the same response, difficulty maintaining an erection with a partner, delayed or absent orgasm outside that specific routine. Signs to watch for: you only feel aroused with a very particular visual or mechanical stimulus. You find you must rush or increase intensity to get results. Private masturbation and partner intimacy feel very different. The first practical response is simple: slow down and vary the pattern. Give your nervous system different inputs. Practicing slower, mindful touch rewires expectation. It's not moralizing what you've done, it's retraining. In many cases, men like Hector regain sensitivity by shifting stimulation patterns and giving the nervous system time to adapt.
The second mistake is the opposite extreme: complete avoidance of sexual contact and ejaculation. Roberto, 68, stopped sexual activity after a painful urinary episode years earlier. He thought avoidance would protect him. Instead, he developed worsened urinary symptoms, interrupted sleep, and a persistent sense of bloating in the pelvic area. He told me he felt physically heavier and less energetic. He assumed this was just getting old. The prostate and pelvic tissues produce fluids that are part of normal male physiology. While occasional changes happen with aging, prolonged total avoidance of ejaculation in some men can contribute to a pattern of stagnation we often call prostate congestion. That word sounds alarming, but it simply describes fluid and pressure staying in the gland and local tissues, rather than being moved through regular sexual activity. Congestion can be associated with discomfort, urinary urgency, and inflammation. Large cohort studies have found associations between more frequent ejaculation and lower risk of certain prostate conditions, though that's an association, not a promise of prevention. The key point is this: regular sexual activity, whether with a partner or by yourself, serves as a kind of maintenance for the vascular and glandular tissues in the pelvic area. It helps oxygenate tissue, maintain blood flow, and keep neural pathways active. If you've gone long periods without sexual release, you don't need to jump into high-demand sexual encounters. Start gradually. Light, regular activity, even simple erections during sleep or touch that doesn't aim solely at orgasm, supports tissue health. For men like Roberto, reintroducing regular, gentle sexual activity led to reduced pelvic discomfort and better sleep in many cases. Again, I'm not promising a cure, but simple frequency and movement are a form of self-care for pelvic health. The third widespread problem is emotional: shame, isolation, and disconnection. Louis, 72, stopped talking to anyone about what he was feeling. He withdrew socially, slept poorly, and his mood dropped. Javier, 73, believed that low libido and weak erections were proof of diminished masculinity. He stopped exercising and lost interest in activities he used to enjoy. Both men experienced a cascade: shame driving stress hormones higher, stress hampering sexual response, inactivity lowering testosterone over time, and a downward spiral affecting mood, sleep, and cardiovascular health. This is not just theory. Psychological stress increases cortisol and other stress hormones that interfere with sexual desire and erectile function. Disuse and social isolation are linked to lower activity levels and hormonal shifts that reduce overall vitality. The good news is that these are modifiable. Connection to others, to a partner, and importantly to your own body counter shame.
Movement, social engagement, and small wins rebuild confidence and can positively influence hormones like testosterone, though changes are often gradual and individual. So those are the 3 errors: the hyper-conditioned high-intensity routine that narrows sensitivity, the long-term avoidance that leads to tissue stagnation and urinary complaints, and the shame-driven withdrawal that undermines mood and endocrine balance. Each can be a separate problem or combine in the same person. And for many men, the first sensible step is not medication, but reconnection. This brings me to the practical part, the reconnection protocol. This is a 10-minute daily practice designed to reestablish gentle, mindful contact with your body and retrain the nervous system. It's not about achieving an orgasm every time. It's about noticing sensation, lowering urgency, and rebuilding a relationship with your sexual self. Do this gently, without judgment, and track results over a 30-day period. Begin by creating a safe, private setting. Pick a time of day when you won't be interrupted. Sit or lie comfortably. 10 minutes is the goal. If you're anxious, start with 5. The first step is 5 deep breaths. Breathe in slowly through your nose, let your belly rise, and exhale longer than the inhale. Let your shoulders drop. These breaths signal safety to your brain. Next, bring attention to your hands and the surface of your skin. Touch slowly and intentionally. Move with curiosity rather than urgency. Explore different pressures and rhythms, but avoid the rapid, habitual patterns you may have used. Think of this as touching to notice rather than to finish. If intrusive thoughts or shame arise, label them briefly. There's shame, and return your attention to sensation. Naming the thought reduces its power. If you choose to allow ejaculation, that's fine. It's optional in this protocol. The primary goal is reconnection, not a performance outcome. After you touch for several minutes, slow your breathing again and let the sensation settle. If you reach climax, let it happen without judgment. If you don't, that's entirely okay. The real practice is in the non-goal directed attention. Repeat this daily for 30 days. Track simple metrics: mood, sleep quality, morning erections, ease of intimacy, and urinary symptoms. Many men notice small changes in the first week: more relaxed sexual curiosity, a reduction in anxiety around intimacy, and more measurable shifts by weeks 3 to 4. Remember, neuroplasticity is real. The nervous system at any age can learn new patterns when given consistent, gentle input. If you have a partner, you can adapt the practice. Share the idea of intentional, non-pressured touch. Practice light hand-holding, non-sexual massage, or simply sitting close without expectation. Communication matters. Tell your partner this is a reconnection exercise, not a demand for performance. Some couples find that changing the context, less urgency, more curiosity, restores intimacy faster than anything else. If you're single, treat this as a personal health practice. Now about pornography. I will not moralize your choices, but I will speak clinically. High-intensity visual stimulation can accelerate neural conditioning toward very specific cues, making real-life touch feel underwhelming. If you suspect that visual content has shaped your arousal patterns, consider a 30-day visual reset. No porn, no high-intensity visual stimulation. Replace it with a reconnection practice and other pleasurable, non-sexual activities. For some men, a gradual reduction works better. For others, a clean break for a month makes the contrast obvious. The aim is to give your nervous system a chance to recalibrate to more natural, varied inputs. Alongside the protocol, support your body with everyday habits that influence sexual health. Regular physical activity, especially strength training and cardiovascular work, supports vascular health. Good sleep is crucial for hormonal balance. A balanced diet and moderate alcohol consumption help maintain energy and vascular tone. These lifestyle elements complement reconnection. Think of the protocol as targeted retraining and lifestyle as broad support. I need to be clear about boundaries. This approach is not a guaranteed cure for erectile dysfunction, prostate disease, low testosterone, or other medical conditions. If you experience severe pain, visible blood in urine or semen, sudden and complete loss of erectile function, marked urinary retention or obstructive urinary symptoms, severe depression, or thoughts of harming yourself, seek medical evaluation promptly. In those situations, behavioral strategies are part of a larger care plan that may include laboratory tests, imaging, or medical treatments. If you're on medications that affect sexual function, don't stop them with medical guidance. If you have a history of prostate cancer or are under active cancer surveillance, discuss sexual activity and any changes with your treating clinician. For many men, however, the first step can safely be behavioral. Reconnection may reduce the need for medications for some, but not all. Pharmaceuticals, injections, or procedures are important tools and are sometimes the right choice. My aim is to encourage you to try an evidence-informed, non-pharmaceutical approach first when the situation is appropriate, because it can restore confidence, improve comfort, and in some cases, improve measurable function. Let's imagine practical examples to make this concrete. Hector swapped his autopilot routine for the 10-minute mindful touch practice each morning. He stopped using high-intensity visual material during the day. At 3 weeks, he noticed he felt less frantic and could sustain arousal with his partner more easily.
Roberto's started with short, gentle nights of touch and occasional ejaculation once a week, gradually increasing to 2 or 3 times as his comfort returned. His pelvic discomfort eased, and he slept more soundly. Luis joined a small social group and began the practice too. His mood improved, he moved more, and his energy came back. Javier added strength training to the protocol after his doctor ruled out urgent causes of low testosterone. His overall vitality improved, and sexual function followed an upward trend. If you choose to try this, keep a simple journal. Note duration of practice, mood before and after, sleep quality, morning erections, and any urinary changes. Small, regular notes help you and your clinician see patterns. After 30 days, review your notes and decide if you want to continue behavioral work or pursue further medical evaluation. If progress feels limited or if symptoms are severe, schedule an appointment for a thorough assessment. Sexual health is connected to vascular health, metabolic status, and mental health. Evaluating blood pressure, glucose control, lipid profile, and hormone levels may be useful in some cases, but those tests are part of an individualized plan, not a blanket prescription. A few practical tips to get started today. Pick a consistent time that feels manageable. Keep the environment private and comfortable. Set a simple timer if that helps you commit to 10 minutes. Resist the urge to multitask, and be compassionate with yourself. This practice is about curiosity, not achievement. If shame shows up, remember you're doing a health exercise, like stretching a joint. Treat it the same way you would start a walking routine. Small steps, consistent repetition, and patience. Before I close, one more clinical point. Erections are a vascular event as much as a neurological one. Regular blood flow keeps penile tissue healthy. Inactivity can contribute to tissue changes over time. Treating sexual health as part of your overall cardiovascular maintenance makes sense. If you have known heart disease, talk with your cardiologist about what level of activity is safe. If you have concerns about hormones, ask for a measured discussion with a clinician who can interpret labs in the context of your full health picture. You are not broken. Your body and brain retain the capacity to learn and adapt even later in life. Small, consistent practices often produce measurable improvements in confidence, comfort, and function. Start with 10 minutes a day of reconnection. Give it 30 days and observe what changes. If the practice helps, share that with your partner or your clinician. If you don't see improvement, especially if symptoms are severe, seek medical evaluation. There are additional tools we can explore together. If you felt this message today, type yes in the comments to say you'll try the 30-day reconnection. I'll check responses and follow up with a Q&A video.
And please subscribe for more practical, evidence-informed advice on men's health. Start gently, stay consistent, and treat this like the health habit it is. Your body remembers how to respond. Sometimes it just needs a little guidance.